Sure.
IPPHO IPPHO monthly nursing classes, which we have been having for the past 1 year. So the main aim is to empower the nurses through the common topics in the pediatric hemato-oncology. So today we have chosen a very basic topic, the neutropenic care, which is common not only for oncology but hematological conditions, including aplastic anemia as well. So basically, a care of an immunocompromised child is a special one, which the treating nurses should be very aware of. So, for to speak on that, we have two people. Dr. Vinod Gunasekaran, he's a consultant pediatric hemato-oncologist from Kaveri Hospitals, Trichy. He's my senior and a very great speaker. And Ms. Aarti, staff nurse from his center as well, is going to contribute to the topic. So thank you both for agreeing for the session and giving your time. We'll have the session by Dr. Vinod first, followed by Ms. Aarti, probably in the next 30 to 40 minutes. We'll have the last 10 to 15 minutes for discussions if there is anything. So I'll hand over to Dr. Vinod to start the session. I request all the participants to actively interact and they can post the questions and comments on the chat box, which we can take up at the end. I hand over to you, Dr. Vinod.
Fine. Thank you, Dr. Dharani, for giving me the opportunity. So again, as you mentioned, this nursing care is extremely important for neutropenic patients because whether they are going to get discharged well or they are going to ICU, get sepsis, shock and die, everything depends on how a staff nurse handles that particular patient. Because a single bacteria enters in, that may be the end of life for the patient. So extreme precautions have to be implemented. It's equal to a neutropenic patient, according to me, is equal to handling a preterm baby, say around 850-gram baby. How we handle that much of delicacy we have to provide for a neutropenic patient. So first I will share some of my slides and then our staff nurse will discuss her views and then we will close the session. So nursing care of neutropenic child. So before we discuss about how to handle a neutropenic child, we should know what is neutropenia. So as we know, a CBC report shows the hemoglobin level, white cell count, platelet count. And then we have the differential count, that is neutrophil so many percent, lymphocyte so much of percent, monocyte and eosinophil, etc. So with which we have to calculate the absolute neutrophil count of the patient. Many CBC reports in most of the hospitals do not give ANC or absolute neutrophil count in a separate column. Sometimes we may have to calculate. So it's better we know how to calculate the absolute neutrophil count. The normal neutrophil count in a normal individual is roughly more than 1500. But for all practical purposes, any neutrophil count less than 1000 is taken as a neutropenia. So the formula for calculating ANC is neutrophil percentage divided by 100 into WBC. The example 1, we have white cell count 4000, neutrophil 50%, lymphocyte, monocyte, eosinophil, etc. So that is the absolute neutrophil count in this report is 50 divided by 100 into white cell count, that is 4000. So if we calculate, it's 1/2 into 4000, that is 2000. So in example 1, the patient is non-neutropenic. We have the example 2 where the white cell count is 1500, which itself is low. Normal white cell count is roughly 4000 to 11,000. And the neutrophil is 10%, lymphocyte 80%, and so on. So we apply the same formula. ANC is equal to neutrophil, that is 10, divided by 100 into 1500, that is 1/10 into 1500, that is 150. So this patient is extremely neutropenic. So both may be leukemia patients, but the fever, presence of fever in example 1 is totally different from presence of fever in example 2. So in example 2, if the patient has fever, it is a medical emergency, we may have to act immediately. Whereas in example 1, patient is stable, normal neutrophil, we may send the patient in OPD basis with some symptomatic medicines. So that is the total difference in management between a normal patient or a non-neutropenic patient and a neutropenic patient. So who all can have neutropenia? So by seeing a patient and what treatment they are receiving, we should have a rough idea that this patient is immunocompromised or maybe neutropenic. Even before the CBC count is ready, we should suspect that this patient may be a neutropenic patient. When any patient who has just received a chemotherapy or a radiotherapy or is undergoing a bone marrow transplant. As Dr. Dharani mentioned, aplastic anemia, the bone marrow stops functioning. So hemoglobin, white cell platelet, nothing is formed in the bone marrow. So all blood counts are low. These are all immunocompromised patients. Even before receiving chemotherapy, any malignancy which involves the bone marrow will suppress the normal blood cells. Like for example, leukemia, neuroblastoma involving the bone marrow, etc., may have low blood counts, even a diagnosis, even before giving chemotherapy. So we have to handle all these patients as a immunocompromised neutropenic patient. Not just hematology, oncology, any other condition, a normal infected patient, like for example, dengue or a malaria, etc., they have infection-induced bone marrow suppression or hemophagocytic lymphohistiocytosis, like HLH. They also can have a bone marrow suppression with underlying neutropenia. A patient on certain drugs, for example, methotrexate is given for rheumatoid patients. So these are all patients who can have episodes of neutropenia with fever. And there can be autoimmune destruction of neutrophils like ITP, autoimmune hemolytic anemia. We can have neutropenia secondary to autoimmune condition, example SLE. So these are some of the common clinical scenarios where we can expect the patient to have neutropenia even before we receive the CBC report. So again, a single report of CBC with neutropenia may not be exactly showing the chances of infection. For example, a patient with AML, acute myeloid leukemia, admitted in the hospital for 2 weeks. For the past 1 week, the patient is having neutropenia. Longer the duration of neutropenia, higher the chances that the patient can get in a serious infection. It may be bacterial, fungal, or viral, etc. Similarly, the severity of neutropenia. As I mentioned, neutrophil count less than 1,000, we say it is neutropenia. But a patient with absolute neutrophil count just 100 is different from an absolute neutrophil count of 900. So anything less than 500, the lower the value, the higher the chances of infection. So again, we have to calculate the neutrophil count and see the clinical setting, what phase of treatment, what is the type of treatment, how long the patient is neutropenic, how severe is the neutropenia. All these will predict the chances of getting infection in a given patient. So why neutrophils are important? We have been talking about neutrophils. As I mentioned, WBC also has lymphocytes, eosinophils, basophils. We don't bother about those. Why? Because neutrophils are the predominant cell population. If you see a normal differential count, neutrophil may be 60-70%, lymphocyte 30-40%, and rest small amounts of eosinophil and basophil. So neutrophil is the first line of defense and is a major fighter against infection in our body. So that first line of defense is absent, then the patient is in trouble. So because these are these neutrophils are those cells which will digest the bacterial organisms and the debris from those and clear the infection in the first line. And when all of us, when we have any infection, we all know our white cell count increases. Our baseline may be 5,000. When we have an infection, be it viral or bacterial, the first cell to increase is neutrophil. It is good that our neutrophils increase. It will fight against all these bacteria, virus. It will clear the virus, bacteria, and we get recovered. Even without antibiotics, many infections in a normal immunocompetent patient will recover if the neutrophil response is good and the body fights against these infections. But because of treatment, if the neutrophil counts are low, they are not able to mount a response. They are not able to increase because of the suppression by the chemotherapy or radiotherapy. Then again, our immunity is less. We cannot fight infection. Neutrophil has a half-life of 6 to 7 hours in circulation. Hence, it has to be constantly produced to fight the infection when we are in trouble. So again, neutropenia is okay. Neutropenia, stable neutropenia child, all neutropenic patients will not receive antibiotics. We will not treat them aggressively, but definitely nursing care is important. But once these neutropenic patients develop a fever, for example, at midnight, 11 o'clock, 12 o'clock, a patient who is known to have neutropenia comes with a fever of 101. So we have to immediately act because it is a medical emergency. What is definition of fever and febrile neutropenia? Any single temperature of 101, 38.3 degrees Celsius. Or if the patient is having 100.4 more than 1 hour, it will risk for fever in underlying neutropenia, and hence we will diagnose or label this patient as febrile neutropenia. As I mentioned before, febrile neutropenia is a medical emergency because our neutrophils are less in number. Patients will not able to mount a response to infection. For example, there is a skin infection, there will not be any redness, there will not be any edema, there will not be any pus formation because neutrophils are absent. The only response the patient can mount is fever. So that single 101 fever may be the only indication for underlying severe bacterial infection like say Klebsiella, Pseudomonas, etc. So any fever, neutropenia, our action to be fast. So we have to administer antibiotics within 1 hour of presentation to the ward. Take blood culture, give antibiotics within 1 hour. The patient is going to the hospital with fever and neutropenia. So coming to the nursing part, we know like any infected patient, we implement barrier nursing because we should not catch the infection from the patient and we should not spread it to others. Similarly, immunocompromised patients, the totally reverse one. So immunocompromised patient, just because the levels are low doesn't mean but they cannot fight infection. So we have to again consider a reverse barrier nursing to prevent from going into the patient from our side. So with this, I will stop.
Can I request all the other people to mute, please? Yeah, thank you. Thank you, sir.
Yes. So now I request our staff nurse, Aarti, to share some of the slides. And we'll go back to the final part of it. Can you see the slides?
We are not able to see the slides.
Yeah,
Yeah, currently we can. Yes, yes. It's visible now.
Yeah, she will start.
Good evening to all. I'm Aarti. I'm working as a pediatric nurse in
Vinod sir, good afternoon.
Hello, Dr. Siaram.
Hi, sir.
Welcome, welcome. We are in the middle of the presentation. We'll go through. Now, our staff nurse will be sharing the nursing role in neutropenic patients.
Now I'm going to nursing role in the care of neutropenic patients. Neutropenia means decreased neutrophil counts in the blood in our body. Neutrophils is one of the white blood cells. White blood cells are fight against the infections in our body. If the white blood cells, neutrophils are decreased, they are get easily infections. So our nursing care is more important to prevent the infection and reduce the risk of further infections. Now I'm going to what are the most important nursing care is needed for neutropenic patients. First one is implement neutropenic care and promote hygiene. In hygiene, we are discussing about main topic of hand hygiene, oral care, skin care, peri-hand care, and prevent skin breakdown. Maintain aseptic technique in all the procedures. Administer medication as ordered properly. Promote nutrition. Nutrition is most important interventions of nursing care for neutropenic patients. Educate on signs and symptoms of the patients and the caregivers because it helps to receive the treatment of infections easily. Now moving on, first one of implement neutropenic care. The neutropenic patients are immunocompromised patients. So they are allowed only in hygienic area or the isolation ward. Never allowed to stay in common ward or unhygienic area. So maintain isolation technique as appropriate is reduced exposure to the environmental pathogens. Then the patients with neutropenia are susceptible to infections and must be isolated. Accordingly, limiting visitors reduce the risk of infections. If the visitors have come, instruct the visitors to wash hands on entering, leaving the patient's rooms, and wearing mask helps to prevent the transmissions of harmful pathogens from to the patients. Next, moving on, promote hygiene. Proper hygiene reduce the risk for infection, which is our main concern for neutropenic patients. In hygiene, hand hygiene is most concern. in hand hygiene, teach to the patient and caregivers about proper hand washing techniques, because hand washing is an effective infection control method. Germs from washed hands can easily be transmitted from person to person. All the staffs and medical personnel should maintain the hand hygiene proper, because it helps to prevent the infection, transmission of infection from one patient to another person. Next, moving on, oral care. The mouth is in the place that can get infected easily, especially if a patient is on oral antibiotic, which destroys some of the good bacteria also. That is ideal. If someone who is about on entire treatment that may cause neutropenia, like the treatment of chemotherapy. So the patient before entering the treatment can get dental examination prior. In oral hygiene has to be done in two ways. One is mouthwash by mouth gargling. Another one is soft brushing. In mouth gargling, we have used for chlorhexidine solution. We have to be done in 6 times a day. After, before and after food for morning, afternoon, and night. Other one is soft brushing. We are also prefer for soft brushing because it is not hurt your gums and it reduce the risk of gum bleeding. If you use hard one, it will hurt your gums and it may risk the bleeding from humps. Next, moving on, skincare. Daily bathing is compulsory and no excuses in that, and low laziness to be done. Daily bath in normal or warm water is preferable to provide adequate rest, because if the patient is having heavy workout, they get more sweating. The sweating and the destroyed cells in our body may cause easily get infection. So when the patient getting excess sweating, the patient get immediate bath. Next, moving on, perianal care. Perianal care is something more important. When the patient is passing a stool or urine, they have to wash the area with soap and water and clean the area by using clean cloth or tissues. Never keep the area wet because it can cause the chances of infections. Next, move on, prevent skin breakdown. Skin is the essential aspects of our body that prevents the infections. Therefore, if the skin is compromised to the infection, it can be quite a problem for a patient with neutropenia. Prevent ulcers and breakdown of skins is important because in neutropenic patient, they may have to not able to heal properly. Next, moving on, maintain aseptic technique. The nurse and all the staff should maintain strict aseptic technique when accessing the IV lines or ports, cleaning catheters or tubings during the care given, or even though touching the patients also. Next, moving on, administer medications as ordered. The most preferable and important one is the granulocyte colony stimulating factors. After given this medications, it helps to stimulate our bone marrow to produce more neutrophils. Then instruct the patient to take antibiotic as prescribed. It helps to prevent microbial resistance. Next, moving on, promote nutrition. Nutrition and ensure food is prepared and stored appropriately. Nutrition is another important nursing intervention because food is that not stored or prepared properly could cause infections like foodborne illness that could be quite detrimental to the neutropenic patients. Avoid uncooked meats or eggs, unpasteurized milk and dairy products, and uncooked or unwashed fruits and vegetables. Allow only foods of all pasteurized grade A milk and milk products, example ice creams, cheese and milkshakes, and all thoroughly cooked and canned meats, example beef, fish, shellfish, etc., and thoroughly cooked eggs. Next, moving on, educate on signs and symptoms of infections. Teach the patients and caregivers about the signs and symptoms of infections like irregular heartbeat, fever, mental irritable. If the patients or caregivers know the symptoms, they are know to when to report them to healthcare providers. It helps to receive the yearly treatment of infections. Thank you.
Thank you. So we have just some more slides. I think Sister Aarti has covered all the topics beautifully. So I think I have nothing more, but still I have made few more slides. Maybe I'll just share them and finish off. So I think, as mentioned, I think Sister Rati has beautifully covered all the aspects of neutropenic nursing. Next few of my slides may be a repetition, but I think still it is worth to like repeatedly reinforce us to implement the neutropenic care appropriately. I think, as mentioned, private room with a negative pressure is priority. You should not. Sorry, there's a positive pressure ventilation is always a priority. We should never ever keep a neutropenic patient in a negative pressure room because all the outside air will be sucked in and all the infections will be coming into the room. So in BMT, we always have a positive pressure in the rooms, especially. And promote mask, wearing mask like all of us did in COVID. Hand hygiene, as has been discussed, especially if our hands are visibly soiled or the patient is a culture positive or C. difficile positive. In between patients, compulsorily we have to do hand wash along with using an alcohol drug. If it is a clean patient, our hands are also clean. Alcohol-based drug alone is sufficient. And as mentioned, all procedures should be done in a very hygienic way. The common mistakes which we see is like, especially the peripheral IV cannulation, which is always done by the nurses. We try a cannula once, so maybe the vein is getting bulged. We will keep the cannula on just on the bed, directly on the bed, which gets contaminated. And then we reuse the same cannula for a different vein. So that should never be practiced. We should have an aseptic area where we should keep the used cannula, and especially when we are reusing it. So what we I practically suggest is, ideally we should have an aseptic tray, but if that is not possible, the cannula cap, the cannula cover, which is open, it is actually sterile in the inner surface of the cannula cover. So we can just invert the cannula cover and keep it over the sterile area if you want to reuse the cannula. So that is the preferable aseptic way, especially during the IV cannulation. Never keep the cannula on a bedside directly, or the directly contact with the bed. So while at home, neutropenic patients should never allow to have pets. No flowers or dried flowers, etc. No live plants. And no cough cold in the visitors, no cough cold in the healthcare workers. Limit visitors is always a problem once we counsel the patient about any leukemia or whatever. So every patient, every relative in the whole district will enter into the patient room in another 2 hours and give all possible viral infections into the patient's room. So we should limit visitors right from day one. We should counsel them. It is not for our benefit. It is for your child's benefit. See, in the entire ward, you should say your child is the most immunocompromised because it has a neutropenia. So please restrict visitors for your child's sake. If they give an infection, they go home, they will get the infection cleared by themselves. But your child who has neutropenia will have problem in clearing the infection. That is the strict counseling we have to give to the patient visitors, especially the parents. They should limit visitors right from day one. So again, most common problem is especially when the patient lands in emergency at night times. Different emergency practitioner may be seeing the patient and different set of nurses will be handling. Patient comes with fever, immediately they will put one paracetamol rectal suppository. There is no rectal suppository allowed in a neutropenic patient. The moment you stimulate the rectal mucosa with any type, even with the paracetamol rectal suppository, if there is a rectal tear, we know the lower gut is full of bacteria. That bacteria will get enter into the bloodstream and may cause serious infection. So neutropenic patient, for all chemotherapy patient, no rectal suppository, no enema, no rectal thermometers, nothing. Similarly, we should minimally use the extra catheters, etc. For example, Foley's catheter, NG tubes, IM injections, all these should be used only if definitely required. If the patient is able to pass urine, we are able to monitor, no urinary catheter. Able to take orally, no NG tube. If the medicine can be given IV or orally, no IM injection. As mentioned, soft brush is always preferable. Diet, again, as discussed, the common question is whether we can have fruits. In general, most of the hospital allow fruits which can be peeled, and in this example, orange, wherever be the oranges be kept in the market, there is a thick cover of skin which protects the inner side of the orange. So we have to wash it, peel it, and eat it. Whereas fruits like grapes, dates, etc., generally most hospitals don't allow because there is nothing to peel or remove the tough skin of the outer surface. Anyway, any other food, vegetables, everything should be washed thoroughly, completely cooked. No half cooked, half boiled eggs, fried rice type of foods are not allowed. Every fruit, vegetable, rice, etc. has to be completely and freshly cooked. No reheated foods. And all the vessels, knife, cutting board, etc. has to be clean. These are all counseling we have to give the parents at home. The cutting board, number in our home, it may be slightly dirty, but it has to be properly taken care, especially when they have a neutropenic patient at home. Fruits, as I mentioned, we should peel the outer surface, example, banana, orange, pomegranate, etc. Dairy products, always pasteurized. And coming to the investigation, we have discussed about the CBC and differential count. And at normal WBC, in this example, WBC is normal. That doesn't mean the patient does not have neutropenia. Neutropenia can be there even with a normal WBC count. In this example, WBC 4500 is pretty normal, but we see the differential count, neutrophil 5, lymphocyte 90. So when we calculate the absolute neutrophil count, it is 5 divided by 100 into 4500, that is 5 into 45, that is 225. Again, this patient has a severe neutropenia. So only hemoglobin WBC platelet is not sufficient. See the neutrophil percentage, calculate the absolute neutrophil count before you label a patient as a neutropenic or a non-neutropenic. So the moment we have a febrile neutropenia, so after CBC, immediate test we have to take is the blood culture. So we should take, if the child has a central line, should be taken from both central line and the peripheral blood. After blood culture, without waiting, we should give our first line antibiotic. Different hospitals will have different first line. For example, cefoperazone, sulbactam, piperacillin, tazobactam. These are all the common first line antibiotics, and it is not a ceftriaxone. So it has to be a anti-pseudomonal antibiotics like cefoperazone, sulbactam, piperacillin, tazobactam, cefepime, etc. So these are the minimum investigations. But if the patient has other findings like dysuria, cough, cold, breathing difficulty, etc., we may end up doing urine culture, CT chest. If you suspect a fungal infection, we may send galactomannan antigen to look for aspergillus infection. These are the basic investigations that has to be done. When you examine the patient, how to examine? Again, as I mentioned, a neutropenic patient is equal to or more or less an ICU patient. So vitals has to be monitored every 4 hours or earlier if required, which should minimum include temperature, pulse rate, respiratory rate, blood pressure, capillary refilling time, peripheral perfusion, pulse volume. Urine output has to be meticulously calculated. Stool pattern, most neutropenic patients can have mucositis, diarrhea. So stool pattern, urine output are equally important vital signs to be monitored. Where on examination, I think it's equally important for the nurse to have a thorough head-to-toe examination of the patient. The most common sites which are missed by the doctor as well as the nurses, the oral cavity. That can be oral ulcers, oral candida in a neutropenic patient. Then we may have to add candid mouth paint or etc. Axillary region, buttocks region. These are all the places, as Sister Aarti mentioned, sweat can get accumulated here and easily fungus can grow. The axilla, buttocks, genital region, perineal region can have fungal growth like the picture shown here. Skin infections, they may not have a full-blown redness or induration, but some changes have to be looked for, especially if the patient has a central line or even IV cannula. We should look for the central line site if there is any infection, discharge, swelling, redness, etc. Peripheral vein thrombophlebitis. When was the line inserted? How is the patency? Is there any thrombophlebitis, pain, swelling, etc. have to be checked during every nurse's shift. And it's always important to look how the abdomen is. It soft? How is the mental status? Whether the child is speaking normally or looking confused, drowsy, dull, etc. All these are important signs of an underlying serious problem. Any chest sounds like a stridor, etc. also have to be looked for. Perineal care has been mentioned. So in general, we have to counsel the patient to daily take a bath with a mild soap. In general, in our mentality, any patient who is ill, the family stops bathing the child, but we should encourage them that the child should bath daily with a mild soap. If there is a diarrhea, use a barrier cream in the perineal region. Otherwise, the acidic stool may cause the skin integrity to be lost. There can be a perineal rash. So a barrier cream should be started the moment the patient has diarrhea. If there is a mild excoriation, try to keep the area open and apply the barrier cream. If there is a fungal rash, add clotrimazole cream. Severe excoriation, better to add an antibacterial cream like silver or a mupirocin cream. If there is an anal tear. Sometimes neutropenic patients with constipation can have a very painful anal tear. It's better to add xylocaine cream topically and a systemic painkiller like to minimize the patient discomfort. So coming to treatment, as such neutropenia, there is no treatment. We should just wait till the patient recovers from the effect of chemotherapy. The patient has neutropenia because he or she has received chemotherapy. So we have to wait for another 7-10 days for the neutropenia to recover. Till then, we have to take care of the patient with extreme careful aseptic precautions, which we discussed all these presentations. GCSF, which the staff nurse mentioned, we should start if started. So some patients we may not give GCSF. For example, a leukemia patient with a neutropenia we may not give GCSF. Similarly, aplastic anemia, if it's not responding to GCSF, we may not continue. So, but in solid tumor chemo, we use. In a leukemia patient is sick, we use. So GCSF, as per the doctor's order, we have to give, which will definitely speed up the neutrophil recovery. So, neutropenic patients are generally on prophylactic medicines. Prophylaxis means even before the infection comes, we will give some medicine to prevent certain infections. For example, cotrimoxazole, syrup Sustrim or syrup Septron, syrup Bactrim. All these are cotrimoxazole containing syrups, which will be given twice or thrice a week. For example, Saturday, Sunday, or Monday, Wednesday, Friday. So we have to continue these medicines to prevent pneumocystis infection. And a severe neutropenic patient may also be an antifungal, may it be fluconazole or voriconazole, which has to be continued. If any signs of infection, definitely as discussed, IV antibiotics. The patients are going home with existing neutropenia. We have to counsel the parents, relatives, reporting to hospital if there is any warning signs for antibiotic, be it 11 o'clock night, be it 3 o'clock in the morning, they have to come to the hospital to get the treatment. And especially those who have a sibling, 3-year-old sibling, 2-year-old sibling, no live vaccine to the patient or family members. Especially during the pulse polio campaign, patients will have a doubt. Chemo patient, no vaccine, no doubt. Patient's sister, brother, whether they can get this oral polio vaccines, again, it should be a strict no. We should counsel that the sibling has received enough injectable polio vaccines during chemotherapy. It's better the family members also do not receive these polio drops, because polio virus can spread, polio vaccine virus can spread from one to other. In immunocompromised patient, these vaccine virus can also cause trouble. Again, based on the CBC, if the HB or platelet are low, we may require HB platelet transfusions. And granulocyte transfusion is also available. That is, the neutrophils are low. We can harvest neutrophils from a healthy donor, and we can transfuse it to the patient. But we generally opt for it only if the patient is very sick. So because the neutrophils have a very short half-life, if you want to give, it daily, but generally not required if the patient is stable. But in extremely sick patient with neutropenia, even granulocytes can be removed from a healthy donor, and after irradiation, it can be given to the patient who is very sick. So as mentioned, counseling before going home, warning signs when they have to report immediately: any fever, any chill, any new cough or change in cough pattern, sore throat, oral ulcers, diarrhea, abdomen pain, vomiting, headache, dullness, behavioral changes, painful micturition, decreased urine output, redness in any area, catheter set, any problem in general, they should report immediately. Or most of the hospitals will have a call number where the patient can call and inform the symptoms and discuss whether they should visit the hospital immediately or not. So just to summarize, there are a lot of don'ts and lot of do's. So no enema, no suppositories, no further chemotherapy unless the treating doctor. Any patient with neutropenia, we generally stop chemotherapy till the patient recovers. No live vaccines, no constipation generally, because the moment we strain to pass stools, again there can be a tear in the anal mucosa that will cause the spread of bacteria from the gut. So the patients with neutropenia should pass soft stools normally. Especially patient is receiving vincristine, they can have constipation. So we have to give laxatives, say like Laxopeg or Evict, or all these are syrups which are available or powders available to ensure that the patient passes a normal soft stools. No uncooked food, no reheated food, no drinking of tap water directly. It should be a boiled and cooled water. No crowded place, no excess visitors, no contact with persons having active infection. What should be done? Stay isolated, wash hands frequently, cut your nails, bath daily, brush your teeth twice daily, mouthwash frequently, and eat a healthy, freshly cooked food until you recover from your neutropenia. Thank you.
Thank you so much, sir. Thank you so much for the comprehensive discussion on neutropenia, neutropenic care, diet, the examination to be done. So, are there any questions from the participants? Can continue to post. I would just like to ask Dr. Vinod again to quickly highlight the neutropenic diet concept that we have been following. There are two different schools of that. Some hospitals follow, some hospitals do not follow. At least the basic minimum you've already told, but I just quick 4 or 5 points for the nurses to know.
Fine, yeah. So neutropenic, as you said, it differs from hospital to hospital, especially in a Western country. For example, Singapore or USA, in general, the hygiene level in the surroundings may be good, but they may be a little bit relaxed on neutropenic diet. But we know our setting. See, we know our food markets, our hotels, restaurants, etc. So I think it's always wise to be strict on the neutropenic diet. So the basic principle is the food should have a low bacterial contamination. So it should be any food which undergoes a complete cooking. For example, you put rice in a pressure cooker and leave it. You cook a proper food in a pressure cooker. The amount of heat will definitely destroy any bacteria if it is there. Similarly, if you prepare a side dish which is completely boiled in a pan or a completely fried food, all these will destroy your bacteria. So definitely a freshly, completely cooked food is a safer food for neutropenic food. Whereas if it's like half cooked, for example, in fried rice, the carrot beans may not be completely cooked. Definitely, there can be a chance that it can transmit infections. A half cooked, half boiled egg may not be completely cooked food, so we should not allow such half cooked or uncooked food. Or even if it is a completely cooked food, if a rice which is prepared in the morning is consumed in the evening, there is a chance that again bacteria grows in that rice. So freshly prepared, like we cannot be serving within 1 hour or at least 4 to 6 hours is a safe time within which the food should be consumed. Otherwise, you prepare another new food to be given. Number two, fruits. Fruits is a common question. Anybody falls ill will ask us whether we can consume fruits or not. Fruits is again differs from hospital to hospital, but I think general rule is any fruit which has a thick skin, a banana. It can be kept everywhere in the market, but the inner part of the banana is less likely to be contaminated. So you open the banana and eat, the inner part is definitely going to be hygienic. Similarly, like oranges, pomegranate, etc. Apple, general question is whether we can consume apple. You just clean it and remove a thick layer of skin and then consume the inner part. So any food which can be like any uncooked food, if it is having a thick cover, a natural protection to prevent bacteria to go in, can still be considered into the neutropenic diet consumption. Water is very important. Like we may ask the patient to take boiled water, but what the patient does, maybe just keep in the stove, the water becomes slightly warm, they'll just often start consuming. That is not a boiled water. So the water should come to 100 degrees where it becomes a rolling boil water. Bubble should be there for continuous 5 minutes. So then it's a sterilized water. So we just stop. Then we allow it to cool and preserve in a closed container and then consume. So you heat the boil. So here you boil the water. Again, you leave it open. Again, mosquitoes can breed on it. So that is not a hygienic food. So you rolling boiled water, cooled and kept in a closed container, it can be consumed forever. So these are all the basic principles. And again, Dr. Dharani can add if I have left any.
I think you've covered everything. So it's definitely extensive. And some people with this era of all packed foods, we tell them now to avoid as much as possible. So, or at least use the small sachet and throw it out. At least use and throw. So that they don't preserve that and keep it in the fridge and keep reusing. So if they are very persistent. So that's the only thing that we say extra for the very young children that we ask. The one important point that I would like to highlight from whatever he has already said is when it comes to oncology patients, emergency or what, everyone is tuned to not do certain things, invasive procedures, rectal suppositories. We are tuned when it is an oncology patient, but when it comes to aplastic anemia or some benign hematology post bone marrow transplant, that the neutropenia fact usually doesn't come into the mind immediately, especially the aplastic anemias pre-BMT. We have to understand that they are also neutropenic, and such interventions can cause the same complications in these patients also. So overall neutropenic should be very clearly understood, and whether they are neutropenic currently or not is not the point of concern. When we have a doubt, they are neutropenic. So it's better to treat them like a neutropenic rather than repent later that we should have done this. So these are all the only points that I would like to add. There are, of course, it was a very informative session. There are some feedbacks on that. So if there are no further comments or suggestions, then we will close the session. I would like to thank your staff nurse as well, Ms. Aarti. She has been very informative and very clear on her presentation. Thank you so much.
Thank you.
So, no more questions. Thank you, Vinod sir, once again for taking your time and doing it. We'll close the session. I'll hand over to Ms. Manisha to finalize. Thank you.
Thank you, Dr. Dharani. I would request all the participants to just fill the feedback form. I have put the link in the chat box and I will wait till then. And with this, we can close this session. Thank you so much, everyone.
Thank you.
கடையில வாங்கி கொடுக்கறத தின்னா அப்படித்தான் இருக்கும். அப்புறம் இப்போ கடையில சாப்பிடுறேன்னு சொல்லிட்டு தானே நடக்காம வேணும். எங்க போயிட்டாங்க அதுக்குள்ள ஐநூறுபா இப்ப எங்க இருக்காங்க? அந்த இன்னர் வாங்க போயிருக்காங்க. அந்த இது மாதிரி அடிப்பாங்கல்ல வாங்கி நேற்று எழுதி கொடுத்தாங்க. வாயில அதுதான் 100 ml மருந்தும் தனியா கொடுத்துருக்காங்க. ஒரு அது எத்தனை தடவை அப்புறம் Put that.